Hello, my name is Cynthia Dong, and I'm doing a presentation on the disparities in behavioral health treatment for telehealth. So just a general introduction to this concept. Telemental health is the use of telecommunications or video conferencing technology to provide mental health services. So the expansion of telehealth during the COVID-19 pandemic has demonstrated that it's an effective method to increase access to treatment for behavioral health conditions. The results are comparable to in-person treatment, and policymakers are now looking into expanding telehealth in the US healthcare system because of this. However, research suggests that there may be disparities in access to telehealth among certain populations. Additionally, there are several issues involving digital access affecting how telemedicine is delivered, such as insufficient broadband. We aim to look into where there may be disparities impacting access to telemental health care in this literature review that we did for this project. So during the literature review, we looked for search terms that were related to telemedicine, behavioral health, and health disparities. And we used a combination of these to get the articles that we were looking for. The databases that were used included PubMed, Scopus, Web of Science, and Cochrane Library. So using these appropriate search terms, we then scan abstracts for relevant articles, and we chose articles that seemed to fit our needs. And after that, we would review these articles to make sure that they were indeed relevant to our research before using them. So in the literature, there were a couple of conclusions that we were able to come to. One is that there are 4 big populations experiencing disparities in telemental health access. These populations include rural communities, BIPOC and Hispanic communities, those with low socioeconomic status, and older adults. As you can see in the graphic, these groups are overlapping, and that is because there is a level of intersectionality between these groups. Many of the groups that experience these disparities in telemental health access are communities that are at the intersection of these, and often the intersection of their identities causes greater disparities in access. So these populations are similar to the populations that generally experience poorer health outcomes than average, especially compared to white and richer patients. Another thing we were able to conclude is that the digital divide remains a significant barrier to access for these populations, and the digital divide indeed contributes to these disparities. It is comprised of 3 main things, which is lack of technology, low levels of digital literacy, and insufficient broadband. If we're wanting to address the issues of access, it's imperative that we address these 3 things first. They are essentially social determinants of health for telemental health access, and in addition, these the 3 things that make up the digital divide are important to address because they afford opportunities to things like employment, housing, and food access, which again also greatly impacts health and behavioral health. So it's very important to address for many, many reasons. Telemental health has also been said to be unable to possibly fully treat some conditions, including eating disorders, intellectual and developmental disabilities, and severe mental illness. There were articles disagreeing on this notion. Some believe that it would be possible to treat these disorders. However, there are a couple of things that need to be pointed out, including that eating disorders have a physical component of weigh-ins, and many providers expressed that they were concerned on the level of connection with their patients who have intellectual and developmental disabilities and severe mental illness. Providers list reimbursement and cost issues as the main barriers to implementation for these programs as well. Often it causes them to lose profit and they can't really even break even, which makes it unfeasible to implement telemental health. And the literature on telemental health has a provider-heavy perspective, and we need more patient experiences in the literature. So for future directions, we need to improve Medicaid reimbursement policies for providers to offset these costs of implementation, especially because Medicaid tends to address many of these communities. And they did increase their scope of reimbursement policies during COVID, but many express fear that they will be rolling them back soon. We also need to create initiatives that specifically target access for the populations experiencing disparities to make sure that we have a health equity aim in our approach to this problem. Expanding broadband access, especially in rural areas, is extremely important because rural areas experience some of the greatest gaps in access to proper mental health care and the greatest shortages of mental health services. And additionally, more research on the effectiveness of telehealth and the disparities of telehealth need to be done, especially from the patient perspective, because without the patient perspective, we are really lacking in our perspective on whether or not these strategies are effective. And for acknowledgements, I just want to say thank you to Dr. Janet Becker and Dr. Rebecca Whitaker for their support. A thank you to the Duke-Margolis Center for the opportunity to participate in this research, and for the Kate B. Reynolds Charitable Trust for funding. Thank you.